Uncombable hair syndrome by Regina Telles. What is uncombable hair syndrome? Uncombable hair syndrome is a rare genetic disorder where your child's hair grows in various directions, resulting in a rough, frizzy, and dry texture that makes it challenging or impossible to comb or brush. This condition naturally resolves itself during adolescence with no treatment available. Here are the prompts that I'm going to talk about. There are nine in total, and all of them talk are questions about how they found it, is there a prenatal test, how is it inherited, who can have it, who cannot have it, what are the symptoms. When was this mutation discovered? Who discovered it? The mutation causing uncombable hair syndrome was discovered by Michael Simon and his colleagues at Epidemic Differentiation of Rheumatoid Autoimmunity Unit at Toulouse III, Paul Sabatier University, more than 40 years after the syndrome was first described in 1973 by a Toulouse dermatologist. The study findings were published in the American Journal of Human Genetics, and their research identified recessive mutations in the three genes TCHH, PADI3, and TGASE3 as the genetic cause of the syndrome. What gene or chromosome is affected by this disorder? PADI3, TGM3, and TCHH. Uncombable hair syndrome can be caused by mutations in the PADI3, TGM3, or TCHH gene, inherited in autosomal recessive or autosomal dominant pattern. In some cases, the inheritance pattern of uncombable hair syndrome is unknown. Are there prenatal tests for this disorder? Currently, there are no prenatal tests for the uncombable hair syndrome because the syndrome is rare and known primarily for its unique physical characteristics and does not require going into a setting and complex medical implications. Prenatal testing for this specific disorder may be an easy practice. It is essential to speak with a healthcare provider and someone that knows about this this syndrome so they can like give you more options of what can you do, how to treat it, because there is no cure for this. What are the symptoms of this disorder? The symptoms of uncombable hair syndrome shows the hair growing in different directions, hard, rough, frizzy, and dry. People with this syndrome usually find combing or brushing their hair to be difficult. This syndrome tends to disappear during adolescence with no treatment. What population is affected? Can anyone be a candidate for this disorder? The population affected by uncombable hair syndrome is children between 3 months and 4-year-olds who have blonde or silvery brown frizzy hair. Anyone with this specific hair condition could be a candidate for the disorder. It is more common in kids. This genetic disorder causes hair to stick out of the odd angles, making it difficult to tame or comb. How it is inherited? Uncombable hair syndrome is inherited as a recessive genetic trait. This means that both parents must be carriers of the mutated gene for the child to develop this syndrome. It's not sex-linked as the mutations in the genes are responsible for the syndrome can affect both males and females. The syndrome is passed down when a child inherits one copy of the affected gene from each parent. Are there any treatments for this disorder? Where are they? What does the lifestyle of a person who had disorder look like? As I said, this syndrome doesn't have exact cure, but it has a treatment. It is recommended to be gentle with your hair and avoid something that could be harsh or aggressive, like dyeing your hair or styling it. Also, do not use like stuff that is hot and heat because that will make it more hard to comb or impossible. Also, do not do like perms or like making it more straight. Using products that it could make it more soft or more manageable will be better for this. And during the time pass, like when you're hitting puberty, it will like disappear. This individual be with this disorder have children in the future? Will those children will be affected? Individuals with the combable hair syndrome can have children in the future. If both parents are carriers of the genetic mutation, they're responsible for the syndrome, and there is a possibility that their children may inherit the disorder. However, because this disorder is a rare condition and does not typically lead to serious health complications, the likelihood of passing onto the future generations is pretty low. What is the current status of the research on this disorder? Is there a cure and a treatment coming soon? They are trying to understand the genetic mutations like it to it. Unfortunately, there is no cure for this disorder yet. The only options are gentle hair care and possibly taking biotin supplements to help practice and potentially use biotin supplements for improved manageability, and there is no specific cure on this uncombable hair syndrome. It's a condition that doctors are still studying. Thank you for your time. This is the works cited, the pages that I use for this presentation. Thank you.